Welcome, everyone. I'm Patrick Demelli, CEO of the Covenant family. Thank you all for joining us as we announce our plans for a Covenant wellness community in the heart of Southeast Edmonton. I'd like to extend a special thanks to welcome to our government partners, Premier Jason Kenney, Minister of Health Jason Copping, and Minister of Labour Tyler Shandro. Also Millwoods MP Tim Uppal, Millwoods MLA Christina Gray, City of Edmonton Mayor Amarjeet Sohi, and our city councillors. Also our partners at Alberta Health Services, the Rohit group of companies, our joint venture partner in this innovative project, Hodgson, Schliff, Evans Architects, MXD Development Strategists, Covenant Family Board of Directors, Connie Avila and Alad Morelli for their leadership on this project, and the hundreds of other hands and minds of Covenant who came together to make this vision a reality. This unique health and wellness hub will be the first of its kind in Alberta. Through innovative design, and the wellness community will provide person-centered care and services to patients, residents, and families of all ages and backgrounds. This multifaceted project will include a community health center, multi-generational housing, and integrated seniors center to ensure people can get the care and service they need in one convenient location right at their doorstep. Our leading edge care model will drive a shift in the way we think about healthcare delivery from dependence on hospitals to appropriate, holistic, community-based care and service. We're building the Covenant Wellness Community on Covenant's Southeast Campus in Millwoods, one of Edmonton's most diverse and fastest growing neighborhoods. We choose this location because the population of Southeast Edmonton has nearly doubled in the last 20 years. And with that growth has come a greater demand for health and wellness care. Our Grey Nuns Community Hospital is a key health provider in the neighborhood, and its emergency department is often used as an entry point to the health system. The Covenant Wellness Community is a creative approach for caring for Southeast Edmontonians, relieving hospital pressures and helping seniors to remain well as they age. We'll begin to demolish the Covenant Southeast campus later this month to make space for custom-built structures, which will go up in 5 phases. We plan to reuse about 80% of the original building materials in keeping with our value of stewardship and to limit environmental impacts. Today's announcement comes just a few days after the World Day of the Sick, which reminds us of our mission to provide high-quality care in the best settings to those in need. This is exactly what the Covenant Wellness Community will be, a place where all people will receive the care they need with compassion and dignity. The first is our Community Health Center, which is really the anchor of this project. It'll include some of the outpatient clinics currently located in the Grey Nuns Hospital, helping us to free up hospital space to redesign the busy emergency department with our patients and community in mind. The Community Health Center will also include partners like doctors' offices, lab services, medical imaging, and other complementary health services in one convenient location. In a nutshell, the Community Health Center will be a one-stop shop for all health and wellness services that will deliver efficient, high-quality care using patients and community-centric model. We expect phase 1 construction to begin this summer and open in early 2025. The multi-generational housing will make up the second phase of this project. There'll be around 300 residential units, including independent living and affordable housing, that will welcome people of all ages and backgrounds. We also plan to explore complementary services that support seniors to age with dignity and independence and easy access to the wellness supports they need. Phase 3 is really about revolutionizing seniors care and the way we think about aging. Our integrated seniors continuing care center will tailor care to residents so they can stay with us even as their needs change. Additionally, the center will alleviate some of the transitional and restorative care pressures our hospitals are currently facing. Seniors will have access to a range of care, including long-term care, restorative care, and supportive living, and a menu of services will empower them to stay independent and active in their community. Also located on site will be a center for seniors innovation that will work to continuously enhance care and quality of life for Alberta seniors. Phases 4 and 5 of the Community Wellness Center will include enhanced community health center capacity, care expansion space, and commercial buildings. We will determine the detail of these phases as the future community needs are identified. Covenant has a strong culture of innovation, and it's ideally positioned to embark on this exciting journey. Using a public-private partnership, P3, we are pleased to partner with Rohit Group of Companies to develop the Covenant Wellness Community. As a company with a proven experience in building innovative, sustainable, and community-focused spaces, Rohit is an integral in bringing our vision to life. We are extremely grateful for their collaboration and expertise as we create the Covenant Wellness community together. Using a multi-sectoral approach, we will channel medical retail revenue back into the wellness community, enhancing services for patients and residents and families, and eliminating the need for additional government capital funding. We are proud to build this community of care around the needs of those we serve. Using creative and inclusive care approaches, we will empower Albertans to live and age well within their community. Thank you for joining us today for today's announcement. I would like to now invite Premier Jason Kenney to bring greetings from the Government of Alberta.
Well, thank you very much, Patrick. So happy to be here with Ministers Copping and Shandro, and delighted to see former Premier Stelmach, your chair of Covenant Health, as well as all of the elected officials joining us here today for a very important announcement about expanding healthcare capacity in Alberta and in Edmonton, doing it in an innovative way that gets a lot more bang at the end of the day for taxpayers' buck. This is a great time for new beginnings and leading edge ideas. And I thank Ed and the board and the management of Covenant Health for the invitation. As an MLA and as Premier, Ed Stelmach was always one who advocated for wraparound health services. He stressed the importance of community and being with those you care about when you need them most. As Premier, he chose to lead not just based on the bottom line, but also by being led by his heart. The palpable care that Premier Stelmach had for his constituents and has for all Albertans is one of his many legacies. For me, he's an inspiration to those who share the same values and unyielding compassion. His vision to provide Albertans with housing, healthcare, and services in one location can be seen in the plans for this exciting new concept. And I'd like to congratulate you, Patrick, and your team for being so persistent and innovative in bringing this forward. Ed has never been afraid to roll up his sleeves and serve his community, and this continues to be the case in his work with Covenant Health. It's apparent that community and family are of utmost importance to both Ed and to this great historic organization, Covenant Health. And we know that because Covenant Health carries at its center the legacy of Catholic healthcare in Alberta. At the heart of that is a philosophy of selflessness and of service. The selfless actions of the donors, staff, doctors, and nurses who embody a life of service, caring those who need care, sharing their kindness, generosity, and compassion with their patients and their families. The impact of the legacy of Catholic healthcare in Alberta cannot be understated. From the very first European settlers who came to call Alberta home, for many, the only healthcare they had access to was healthcare provided by Catholic nuns and missions. In fact, it was Les Sœurs de Charité de Saint-Louis, the Sisters of Charity, who would open the first hospital in Alberta, then the Northwest Territories, all the way back in 1863. That's right, the legacy of Catholic health service that Covenant represents today predates not just our province, but Confederation. And it's healthcare that puts the value and dignity of human life at its very center. That's why this new facility being announced today is such a tremendous step forward in Alberta's healthcare network. This concept takes community living and dovetails it with health supports to bring Albertans comfort when it's needed most, challenging the system, not the patient, to achieve the best health outcomes. Sustainable solutions to address an aging population that's growing exponentially each year. Providing mental health supports to our most vulnerable citizens that don't stigmatize or traumatize. Challenging the very definition of quality care and service to others. I look forward to one day seeing villages like this become commonplace across the province as part of a more innovative way of delivering care. Places where people can have all their needs met. A hub that integrates life and health, providing not only one-stop health and wellness, but affordable housing, seniors housing, and even retail spaces. I have no doubt that the Covenant team, with Ed as chair, will achieve this vision in short order. I'd also like to acknowledge the Rohit group of companies, my friends in the Gupta family, and their contribution to this work. There is no greater reward than giving back to the community, offering support when it's needed most. Your investment in this project and your other philanthropic work, like your financial support for a new 24/7 access mental health center in Edmonton, speaks volumes to the culture and values that your company embodies. We know that no one person or group can make meaningful change alone. It's not up to government or business or any one person alone to take sole responsibility for the future. Aligning common goals unites us, coming together to support family, friends, neighbors, and even strangers. This is what makes Alberta great. Every day, I'm amazed at the strength, ingenuity, and creativity found here in our own backyard. The passion to take good ideas and make them better. To think outside the box and look into our hearts. I think that once complete, the Urban Wellness Village will be a concept that carries throughout the province and across Canada. So congratulations to Covenant on getting started on this monumental project. Thanks for your patience. It's great to be partners with you. And looking forward to the rest of the session.
All right, so thank you very much, Premier. I will never forget the day that we zoomed into your office and first presented this project to you, and can't thank you enough for all your leadership and support and guidance. Without that, this wouldn't be possible today, so very, very special thank you for all your leadership. So I think now we'd like to turn it over to invite Minister Jason Copping to bring greetings on behalf of Alberta's Health Ministry. Minister Copping.
Thank you so much, and good afternoon. It is my pleasure to join you today in this great announcement of the Urban Wellness Village development, a visionary new project that will provide services to the rapidly growing communities of Southeast Edmonton. As Alberta's Minister of Health, I'd like to extend my congratulations on this exciting venture. As mentioned by the Premier, this initiative illustrates Covenant's insight, your ingenuity, and your desire to help Edmonton families. The goals of the village will transform the future of the health system in several areas, such as reducing reliance on hospital admission and emergency visits, providing more community-based care, and supporting more timely and effective transition of patients. These are all positive steps to achieving better health care outcomes for Albertans. We know that most people prefer to access services in their local communities, whether they are related to housing, healthcare, or other amenities. This type of living environment advances the vision for more integrated health supports and services right in the heart of the community. Once established, the Urban Wellness Village has the potential to greatly improve accessibility for area residents, patients, and for families as well. Through this project, Covenant is better enabling area residents to get the supports they need to thrive at all life stages. This initiative also reflects the compassion and willingness to embrace a holistic approach to community health and wellness. In closing, I'd like to once again congratulate Covenant and the tremendous work that they're doing to integrate all of these supports and services. Addressing health demands and improving efficiency and effectiveness of the health system is a monumental endeavor. I wish you the best of luck as you move forward in this endeavor and this tremendous work. And once again, I appreciate and thank you for your commitment to enhancing the lives of area families and to building a stronger Alberta healthcare system and a stronger province. Thank you.
Thank you, Minister Copping. We are honored to find innovative ways to make life better for Albertans, and we're humbled and honored for the trust that the government of Alberta puts in Covenant every single day. I would like to especially thank our next speaker. It's not often that we have a Minister of Labour joining a health announcement, but Minister Tyler Shandro, in his time as Minister of Health, was truly inspirational and pivotal in making this announcement happen today. Minister Shandro allowed us to advance our vision for the Covenant Wellness community during his time as Minister of Health. So we're so pleased to have Minister Shandro join us for this announcement today, and we'd like to invite him to say a few words.
Great. Well, thank you so much, and good afternoon, everyone. Thanks for the opportunity to join today. And I want to start by thanking everyone who was involved in this project. As the former Minister of Health, I had the pleasure of working closely with Premier Kenny, former Premier Stelmach. Thank you, Ed, so much. Officials from AHS, former Deputy Minister Lorna Rosen, and the current Deputy Minister Paul Winnick, as we work to develop the letter of intent to establish this Covenant Wellness community. And I got to work in particular very closely with Patrick and Connie. Patrick and Connie, thanks for working with me and the Ministry of Health to build this framework for this new project to be built. And this is a truly remarkable project. The Covenant Wellness community is going to be constructed, as Patrick said, without any government capital funding. It will also really improve what's commonly called patient flow, which is healthcare jargon, which really means making sure that patients get the right care at the right time, but also in the right place. And once fully built and opened, the Urban Wellness Village will provide relief to the Grey Nuns, which has for many years faced increasing pressures from ER visits and higher than average patient population needs. And that ranges from birth rates to the prevalence of chronic diseases. But that is only part of the reason why today is so momentous. My hope is that today's announcement is a sign of things to come. And the letter of intent that made this project possible lays out a path for Covenant Health to build infrastructure, expanding the footprint of Catholic healthcare services in our province for the first time in a long time. And that was one of the reasons why this is really so momentous. One of the reasons that this was an incredibly complicated process for us to navigate with Covenant, the idea of wrapping our heads around how this very important partner in healthcare in Alberta can build new health infrastructure. And they are a key partner in healthcare. It's one of the reasons why we amended the Regional Health Authorities Act in 2020 to explicitly name Covenant in that act as a, quote, key strategic partner. And as Premier said so eloquently in his remarks, the legacy of Catholic healthcare in our province, it can't be understated. Covenant Health is the largest Catholic health provider in Canada. It has a history in Alberta that dates back over 150 years. And I'm hopeful that the Covenant Wellness community will become the first of many new additions to that legacy. It was truly an honor and a privilege to have played a role in that work. So once again, thank you to everyone who worked on this project. And of course, thank you to the 14,000 strong complement of doctors and nurses, staff, and volunteers who make up Covenant Health across Alberta. Thank you so much, Patrick.
Thank you again, Minister Shandro. I said earlier, if it wasn't for the Premier's leadership, we probably wouldn't be standing here today, but if it wasn't for Minister Shandro's sheer tenacity, I'd say, in championing this innovative project, we definitely wouldn't be here either. So we owe you a great debt of gratitude, Minister, and we appreciate all you've done for us. You know, our mission is to provide high-quality, compassionate care and it inspires us to continually seek ways to improve the care we provide while supporting our partners in the health system. To speak more about the Covenant family, I'd like to invite our board chair, Ed Stelmach, to bring greetings from Covenant Health's Board of Directors.
Well, thank you, Patrick, and welcome, everyone. And welcome to our special guests, Premier Kenny, Minister Copping, Minister Shandro, who, as Patrick said, was instrumental in bringing our vision to life. We wouldn't be here today without your support and partnership, and thank you for the very, very kind words and recognizing the role that Catholic healthcare plays in our province of Alberta. For decades, the Covenant family has collaborated with partners and local organizations to bridge healthcare gaps and explore creative models of care and service. We are a key partner within Alberta's integrated health system, steadfast in our commitment to transforming healthcare for our patients, residents, and families. We're proud to leverage our culture of innovation to build a vibrant community of health and healing that delivers timely, comprehensive care to Southeast Edmonton. At its heart, the Covenant Wellness Community is about meeting people and families where they're at and responding to their evolving health and wellness needs. A strong community is essential for health and wellness, and that's why we're bringing a community health center, multi-generational housing, and a senior center together at one location. Using this model, the people we serve can easily access the care and services they need without having to visit a hospital. The Covenant family has a strong commitment to serving people of all backgrounds, faiths, and circumstances. And this initiative is no exception. Keeping person-centered care and accessibility at the core of our work, the Covenant Wellness Community will be an inclusive and welcoming place for everyone who comes through our doors. With that in mind, on behalf of the Covenant Board of Directors, I would like to give a special thank you to our staff, physicians, and volunteers for the tremendous work you do every day. The compassionate care you deliver consistently will be a hallmark of our Covenant Wellness Community. And I thank all of you for joining us here today as we announce this exciting work.
Grab your mask and I'll. Well, thank you, Ed, for highlighting how our strong culture of innovation drives our work to enrich the lives of our patients, residents, and family. Now I'll turn it over to Karen Diaper from our communications team to explain how the media portion of this announcement will work. Karen?
Thank you, Patrick. We have a few questions now. I'm going to move to those who have a question. We're going to ask, please, if you could just limit those questions to one so we can give everyone an opportunity, please. Our first question is Julia Wong with CBC. Thank you, Julia.
Hi, this question is for the Premier. Protesters have left Coots, but what is the province doing to ensure this type of blockade does not happen again? And if these protesters come back, what is the plan?
Thanks, Julia. Let me say how pleased I am that the protesters and those involved in the Coots blockade have peacefully left and gone home. I think the very effective RCMP enforcement action yesterday sent a clear message that we won't tolerate that kind of law breaking. I think it also made some of the protesters realize that they had perhaps unwittingly been associating themselves with people with extremist views and intentions. Once again, I'd like to thank the RCMP for their diligent intelligence work and flawless execution of a complex tactical operation that diffused a potentially violent situation. I understand that charges, some very serious charges have been laid, and the RCMP will be providing news about that shortly. We are now in a much better position than we were to cope quickly and prevent a blockade of this nature, partly because we have now acquired and staged the necessary heavy equipment, and we now have, before this, oddly enough, Alberta did not own its own heavy tow equipment for a situation like this because it was unprecedented. There were challenges in procuring it, but we have that equipment in hand. We have contractors who are willing to provide us with services to help remove, for example, commercial vehicles that are blocking roadways. The RCMP has also demonstrated its intention to enforce, and they have very strong legal tools and disincentives, most especially the Defense of Critical Infrastructure Act. So this is a very positive development. We hope that the situation will continue to de-escalate, and look forward to continuing to work closely with law enforcement to ensure that the rule of law is respected. Once again, The people who were there lawfully certainly have every right to go and protest peacefully and lawfully, to make their voice heard. That's the democratic way. Impairing the lives of others, creating public safety hazards, and hurting our economy is not the Alberta way.
Thank you. And our next question is from Sarah Comadina from Global News.
Hi, I'm just wondering how much this project is estimated to cost and how much of that funding is also coming from the province. And then an additional question too, how many people is this expected to help overall?
Yeah, so phase one of the community health center and retail is approximately $125 million. The overall project itself, excluding the last two phases that aren't planned yet, is a $250 million project. So obviously the expenditure of that will create significant jobs, but most importantly, it's a new way of taking the pressure off the hospital and delivering patient-centered, community-centered care while being very innovative and entrepreneurial. So as was mentioned in the speech, we're not asking the province for any capital contributions to phase one. We would like to talk to the minister about phase two on that one, but we'll save that for another day. And we're able to do that because of the fact that we're finding efficiencies as well as making sure that people get access to care in a very integrated way.
If I could just jump in to say one of the reasons I love this project and kept working with Minister Chandra to get it across the line is exactly this. This is using the kind of innovation we need to see a whole lot more of. Alberta is at the top of the cost curve for healthcare in Canada. Canada's at the top of the cost curve in the developed world, and we're not getting the bang for the taxpayer's buck that we should. We are lagging. Alberta is lagging Canada in terms of, for example, availability of ICU beds, as we've discovered through COVID. This is something that pre-existed COVID. It's been a long-standing issue. And Canada lags much of the developed world when it comes to per capita number of doctors, of hospital beds, of ICU beds, of surgical wait times and diagnostic wait times. So if we've learned one thing from COVID, it must be this. We have to be smarter and more innovative to get more bang for the enormous amount of money that we put into our publicly insured healthcare system. And it's exactly innovative solutions, including public-private partnerships, like Covenant is pioneering here, which I think is the way to do, is one way forward to get more service for more patients at lower cost to the taxpayers. So I'm delighted that there actually is no capital investment by the government of Alberta. Now, obviously, a lot of the services that will be provided, the ambulatory care and other services that will be provided at this campus, will be Alberta Medicare insured services. So that's essentially what the agreement is between the province and Covenant, which is that we are authorizing them to set up this for these services in South Edmonton, will ensure the medically necessary services. They have that certainty that there will be a revenue stream coming from patient care, and yet they go out to the private sector and raise the fund, the capital to actually build the project. It's just a win-win. It's a brilliant, innovative solution. And I should say, big shout out to Minister Chandra for pushing this through. This was like trying to put the system, the bureaucratic system was not used to something like this. Let's put it that way. So it took a lot of creativity on his part to push this through.
Thank you. Our next question is from Janet French with CBC Edmonton.
Hello, this question is for the Premier. We're waiting today to see an order for a red drop for the Fort McMurray-Lac-La-Biche by-election. When is that date, and what do you say to people who say that you are stalling that by-election date in order to stave off challenges to your leadership?
Well, today is the deadline for a writ to be issued. It was just approved by Cabinet and should be signed by the Lieutenant Governor by now or very shortly. That then goes to Elections Alberta for the formal issuance of the writ. And what I say is we've been very clear that we were not going to call an election, in this case a by-election, in the midst of the Omicron wave. We wanted to, as much as possible, defer discretionary political activities like that till we got well past the Omicron peak. That's also why the United Conservative Party has not held any nominations yet. We're just opening those up this week for the same reason. We feel that we're well enough past the Omicron peak that we can move forward cautiously and safely with normal political activities like that. But we just thought it would send the wrong message for the governing party to have people out there going door to door and doing kind of community and retail events while we still had pretty stringent public health measures in place and needed to do our part to reduce viral transmission. So that writ is issued today for March 15th.
Thank you. Our next question is from Shaylan Skulski from CTV Edmonton.
Hi, thank you. My question is for the Premier, and apologies to Covenant Health. It is unrelated to today's announcement. I was just hoping, Premier, to get some clarification regarding an answer you provided yesterday to a reporter's question about the economic impact of the Coutts border closures. And specifically, he had asked about the impact on agriculture. Several times in your response, you referred to the impacts as modest. I'm just wondering if you meant for agriculture alone, or how you would describe the impact the 17 or 18, depending on how you count it, day closure had on Alberta's economy, and what you say to those in the industry who suggest that the closure could actually have some pretty negative repercussions on Alberta's reputation on the international trade stage.
Thanks for the good question. So on an average day, I understand about $56 million of exports from Alberta pass through the Coutts border crossing to the U.S., so that's very important and significant. A lot of that would be agriculture exports, particularly livestock or packed beef and other meat products. And of course, those are spoilable. There was some spoilage early on in the blockade, a little over 2 weeks ago. But what I was trying to say yesterday is that we worked very hard to keep the other 5 ports of entry between Alberta and Montana open and operating. We worked with the United States Customs and Border Protection Agency, the United States government, U.S. agriculture, and of course the Canada Border Services Agency to extend hours at other ports of entry and to move services. The main issue for the livestock industry, of course, is having a port where they could get a U.S. ag inspector. And we managed to provide that, get the U.S. to provide that service at Del Bonita at some points during the blockade, and of course over at Wild Horse on the east side of the province. So the net, I would say that that $56 million of daily exports through Coutts, most of that was not interrupted, but it was terribly inconvenienced, and there's no doubt about that. The uncertainty, part of this is that the folks involved in the convoy kept telling the beef industry that they would allow livestock through, but they weren't necessarily in control of the chaos at what we call checkpoint 10, 15 kilometers north of there, which meant that sometimes southbound trucks were waiting for hours, and so there was a high degree of uncertainty, massive inconvenience, additional costs, and all of that backed up in the system for sure. So the ag producers have been loud and clear, they have been for 2 weeks. They wanted that blockade to end. This created uncertainty. It created additional cost and inconvenience. My point was that it was not a blockade of the border. It was a periodic blockade of one of 6 ports of entry. And if anything, it was probably more impactful for northbound U.S. imports to Alberta requiring CBSA inspections, because generally U.S. commercial and non-commercial traffic was able to come north through the other 5 ports of entry, but at some points CBSA wasn't able to operate at Coutts, so they had to send commercial loads requiring inspection to Sask and BC. Long story short, it was impactful. It's caused real uncertainty, and uncertainty is bad for business. There's no doubt about it. Not minimizing that for 1 second. I'm simply saying that the notion that the entire border was closed for the past 2 weeks is simply not accurate.
Thank you, and we have our last question now. This is Rick Bell with the Calgary Sun. Thank you. it looks like we've lost.
Can you hear me?
We can now.
Okay, good, thank you. Premier, usually in a by-election, the leader of the party, each of the parties campaigns for that party's candidate. We're in a rather odd situation here because your party's candidate is actually running on wanting you to not be the leader anymore, on you to basically resign. How do you handle that when you actually have a United Conservative Party candidate running in the Fort McMurray by-election that doesn't want you to be there? It's a very unusual situation, probably acknowledge.
Rick, you can go ahead and write your 15th column on that. I'll tell you what I'm going to do, focus on my job, the job I was hired by Albertans to do. Today that job involves a creative solution to increase health capacity and services here in Edmonton. We are focused, of course, on ensuring stability and order throughout the period of these blockades and large-scale protests. We're also focused on an effective implementation of our gradual path to reopening and getting life back to normal. And of course, we have the legislative session coming up, what is going to be a very exciting budget, another sign of Alberta's dynamic economic recovery. So I'm going to focus on those things, not on sideshow politics. We are focused on the business of Albertans.
Thank you, everyone. And over to Patrick now. Thank you.
Yeah, so it brings our presentation to a close. I want to thank everyone for joining us for this exciting announcement, and God bless. Thank you, Premier and Minister for being with us, and have a great day.
Recording stopped.